Vidya madam?
Yes.
Yes.
Should
Go ahead.
madam?
Yeah.
Should we start? Okay. Namaskara. Good evening to all the stalwarts of Foxy and Kasoga. It is a great privilege on my part to be part of this event. Today is a very special day, National Safe Motherhood Day. Today is the birth anniversary of Kasturba Gandhi, wife of our father of our nation, Mahatma Gandhi. Today, in 2003, this day was selected as a Safe Motherhood Day, alliance with the White Ribbon Alliance, to make safety of mothers a priority. On this day, government has taken many measures to.
Ma'am, your voice is not heard.
My voice is not heard.
Oh, we can hear it.
We can.
It is
Yes.
heard.
Yeah. We can hear.
It is heard.
We are ready. Okay, it's okay. Go ahead.
You can hear now, sir?
Able to hear you. Yes,
Okay.
yes.
This day highlights the importance of maternal health and also reduce the maternal mortality and morbidity in the country. So on this auspicious day, our new office bearers have selected to launch the new program Vistrit to improve the maternal health care through training the doctors and the healthcare workers. This is a great initiative by Foxy to improve maternal health care in our country. India has, as everybody knows, India has got the highest maternal mortality rate in the world. 12% of maternal mortality occurs in our country, but most of them are preventable with proper knowledge and proper management. So it becomes very important to spread knowledge by training the healthcare workers and also the doctors. So let us start this day by chanting a Shanti mantra. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karavavahai. Om Sahana Vavatu Tejasvinavaditamastu Ma Vidvishavai.
Om Shanti.
Om Shanti Shanti Shanti. Now I call upon Dr. M.G. Hiremat sir, who is the patron of Kasoga. Sir means Kasoga and Kasoga means Dr. M.G. Hiremat. Sir has been the founder secretary of Kasoga and he has been through the all ups and downs of Kasoga. So I call upon sir to bless us on this initiative. Thank you, sir. Please take the...
Let me continue from where Shobha has left. Om Shanti Shanti Shanti. Ellarigu Namaskara. Good evening to everybody. At the outset, I would like to thank for having involved me in this very important program. And this new team of Kasoga, under the leadership of Dr. Vidya Thobbi, which took over on the 2nd of April, and all new faces we are seeing in Kasoga. Dr. Rajeshri Paladi as secretary, Shobha Shavi as chairperson of Safe Motherhood, and Preeti Madam as it is that since last year we got her involved in all our Safe Motherhood program when Sonia Mandappa was the Safe Motherhood Committee chairperson. And you know now our dynamic president Vidya Thobbi has planned so many programs. Whether we are able to run with that or not, I don't know, because we are all old people. But anyway, we try to pick up and get involved into all our programs. Welcome again to Dr. Madhuri Patel Madam, our Secretary General of Foxy, and all the many people who have joined here. Once again, I welcome. It's a very good initiative which is taken by the Foxy under the leadership of Dr. Preeti Kumar, and just for the Safe Motherhood. As you know that today is the National Safe Motherhood Day, and Vidya was very keen that she wanted her program from this day only. Within 48 hours, she has arranged the whole program. Thank you, Preeti, positively responding to Vidya's call and making convenient to join. Welcome to Dr. Jaideep Tank also. And only thing what I was just looking at that this initiative has involved only two problems. One is anemia, another is the GDM. Why Preeti has left hypertensive disease, I don't know. I think if she had involved that also in this training program, the training program would have been complete to see that our mortality, morbidity rate, everything will come down, because hypertensive disease of pregnancy is a huge, and that is the leading cause of death of the mother. But anyway, she has selected these two, and let us do it very systematically, training of these two programs, which will reduce almost 30 to 40% of the maternal mortality in our country. And today we have got galaxy of speakers, chief guest Dr. Hema Divakar and Preeti Madam, and our guest of honor, and uh, many other who are involving. I do not want to take much time. Only let me wish you that this day we are which celebrating as National Day of Safe Motherhood should bring a positive change in our attitude to treat all our mothers. We want every mother to be healthy at every time, and that can be brought down by our committed service. Let us pledge today that we do our service with a very genuine and will do to our best. And with this, I would like to say a very best wishes to this program. And thank you very much once again. Our new Kasoga board very enthusiastically. Many new members have come into them, and 20 committee have joined this time. And programs will be there almost every week in our Kasoga. With this, once again, I request Dr. Preeti to continue to have this program under our Kasoga so that we'll do something to the nation. Thank you. Thank you, everyone. Shobha.
Shobha.
Thank you,
Yeah.
sir. Thank you very much for your blessings. Now, I call upon our president of Foxy, Dr. Rishikesh Pai, to do the presidential address.
Dr. Rishikesh Pai has not joined. Maybe he is some other program. He will join later.
Shall I?
Dr. Madhuri Patel is here. So she will address us.
Dr. Madhuri Patel, Secretary General of Foxy here. So I call upon you, madam, to give you the address.
Madhuri, you have to unmute yourself. Yeah.
Can you hear me, Vidya, now?
Yeah.
Yeah, madam.
Because I'm in the clinic and I said Vidya's
I know.
program, Priti Kumar
Yes,
also, I must join.
Thank you very much.
Yeah, and Vidya, I must congratulate you for the great and grand, you're taking over as a president, and I'm sure you're going to do excellent work. So with this, respected our President Foxy, Dr. H.D. Pai, most dynamic and visionary. Similarly, our Hiramat sir, we have heard now, and he is, really, what you say, he is guru to everybody. Teachers of teacher, and he is a chief patron of Kasoga. And I had, I had followed his footsteps. He was a race committee chairperson of Foxy, and sir has given me over, and his blessings are always with me. So thank you very much, sir. Then our chief guest, Dr. Hema Divakar, and she is really well-known figure, not only nationally but internationally. And the work of GDM she has done, it is commendable. Then, of course, we have our Vice President, Dr. Alka Pandey. Great conference we had in the Labour Code just last week. And Priti Kumar, ever ready to work for the mothers. She has been traveling. She has been on a, webinar. And, she's traveling 150 to 200 kilometers just to train about, PPH, anemia, and this GDM, how to diagnose and treat. And if not treatment, at least refer. So Priti, I am really, congratulate you for the great work. And of course, Vidya, I have already said she's going to do a great, tenure she's going to have. Then Dr. Rajashri, Secretary, Dr. Suman, Treasurer, and our Dr. Shobha, Chairperson of Safe Motherhood Committee, and all my dear friends. Very good evening to all of you. At the outset, I would like to thank the organizer for giving me this opportunity. And of course, I have not forgot about Jaideep Tana. He's a guest of honor, President-elect. So he's not there. So Jaideep, excuse me for that if I'm not forgotten, but it is still there in my mind. So, these two programs, Priti Kumar, when she was taken over as Safe Motherhood Committee, she has really, training all the paramedicals in anemia treatment, how to do GDM, how to do, and that was Jharkhand, na Priti, you started at Jharkhand, and then it was results were really fantastic. And we have taken exam for these paramedical people, And they were knowing so in and out about these two diseases. So we are very happy because we know anemia is a major cause of the maternal mortality and morbidity, and also perinatal mortality and morbidity. It has an indirect, cause, but we have seen PIH, APH, PPH with the anemia. So what we are marching towards a reduction of maternal mortality rate, that is our SGD, of less than 70 per 100,000 live birth. If we remove anemia, if we treat anemia, if we treat PPH, we will can reduce our maternal mortality much more before 2030. Because nowadays our maternal mortality rate is 97 per 100,000 live birth. But with these two things, if we eliminate, our maternal mortality rate can drastically go down, and we can achieve the target before much before than 2030. It is said that the anemia starts from childhood, it aggravates during adolescence, and it worsens during pregnancy. And therefore, our government has realized, and we have started this anemia control program from 1972. But still, we could not control this, anemia. And nowadays, we have even adolescent, national program that we deworm them, and at the same time, once in a week, give them a 200 milligram of iron with folic acid. So even in adolescent, we have started. Pregnancy, there is this that we have to give for 6 months, minimum iron for 6 months and up prepare them. But even adolescent is existing. So let us walk towards that. And GDM, Pema is the best person to talk about DIPSY and all. So these are the two things we have to take care. And today, this is a launch on the Safe Motherhood Day. So Kasoga, I'm really, really happy with you. Excellent. And we have a great speaker, galaxy of eminent speaker who are going to enlighten us and going to take forward this training program. So I thank once again all of you for giving me this opportunity. Thank you very much.
Thank you very much, Madhuri Madam, for for throwing light on problems of anemia and GDM and this initiative called Vistrit in preventing all that. Thank you very much, Madam. Now, our next speaker is Dr. Hema Divakar. Dr. Hema Divakar, Madam needs no introduction. She is the Medical Director of Divakar Specialty Hospital. She is CEO, Chairman of Artist, Dean of Kasoga, Chair of Well Women Healthcare. She has been the past President of Kasoga and Foxy. And Madam has done a great job as an educator. Through Manyata certification, she has trained many paramedical workers and healthcare workers. So she's the right person to talk about this topic, that is engaging partners for improving quality in private health facilities. Please, Madam, the podium is yours.
Thank you, Shubha. Ellarigu namaskara. Matra Devo Bhava. Mothers are everywhere because God cannot be everywhere. That's why He made the mothers. And when we launched this program through Foxy, the Manyata, all of us pledged that we will not let any mother die while giving life. From there, our journey has started. And today, here we are on the 11th of April, Safe Motherhood Day, celebrating the togetherness of our strong intent to do the best for the mothers and mothers-to-be. And for this initiative, when Dr. Hiremat, our patron, asked, why, Preeti, only two issues, GDM and anemia, I must put on records and thank the aid from the USAID under the umbrella of Vistrit project, which was a proposal given by our parent organization, Foxy. And I was going to say Preeti is evergreen, and really she's appeared in a green outfit today. So that is very symbolic of the nature of Preeti, really. And the two things, anemia and GDM, when we say about these two, there is a structured recommended protocol which has to be uniformly followed right across the country, and we know it's not happening. And on a mission mode in this Vistrit project, when we entered through what really should be done, we recognize that it should really, Vistrit, Vistar means to spread all over. And today I'm glad that Karnataka has the privilege of getting the Vistrit to our part of the world. T3, test, treat, and talk. This is the government initiative of anemia. And when we talk to the community workers, paramedicals, and the ASHA workers. T3 malum hai, madam. T3 thyroid na. This was, that this is where it got us thinking that what is there already as a policy, there's a gap in the implementation. Similarly, in the Manyata program, the first standard of antenatal care, everything else they will say properly, except there is a red putty or red mark on the single step test for diabetes. So in fact, these two, everywhere there is a uniformity in our understanding and a non-negotiable execution that needs to be done, 100% universal coverage to get our handle on these two issues, but it's not happening. So with every step we move ahead with projects like Vistrat, expanding the footprints across the country, I'm quite sure that the dream of actually sticking to the clinical protocols, not missing a single case of at least these two high-risk situations, which have lasting impact both on the present and the next generation. So indeed, hearty congratulations to Dr. Vidya Topi. She's banged into action within a week of taking over as the president of Kasoga. It is just a week back that the installation ceremony was done, and with Rajashri Paladi and Shobha Shaini, she has conceptualized this and got us moving ahead. There is a long journey with many other issues to be sorted, and I'm always very, very, very happy about Dr. Pai, Dr. Madhuri Patel, and Dr. Jaideep Tan, and the entire continuum of leadership, which always stands in support and makes us feel that we are doing good, we can do better. And then there's a positivity and a hope of synergies that come together, which is in itself very, very inspiring. And we really love to work for the girls and women to reach the quality care in every nook and corner. So with my very humble best wishes to the entire championship and leadership of Foxy, who are everywhere to make the journey of motherhood safe for all girls and women in this great country. I would say that many, many more initiatives from us, by us, for the women and girls of this country will definitely serve as a role model for the rest of the, not only the low middle income countries, but also the globe. If the challenges can be accepted and the opportunities can be exploited in India, it will work everywhere else, is the kind of concept that generally the people across the world are having. So with very best wishes and a strong promise to support every single endeavor to the best of what we can do, we will do. Namaste, and thank you very much for having me here.
Thank you very much, Hema Madam. We need your guidance throughout this journey. I hope it will be a great journey. Thank you, Madam. Now I call upon Dr. Jaideep Tank, our guest of honor, President-elect of Foxy, to share the experiences of Foxy Vistrit in Jharkhand.
Thank you, Dr. Shobha. I hope I'm audible.
Yes, sir, you are audible, sir.
It's such a pleasure and a privilege to be here. Anything to do with Kasoga is always wonderful to be a part of. I was fortunate enough to be there at the launch of the KCOG, where Dr. Hema Divakar took over as the dean, and I can see that, as always, whatever Dr. Divakar does, progress is more or less assured. So congratulations, madam, and we hope to see you more and more in these roles. It is a pleasure, of course, to listen to Dr. Hiremat sir, the chief patron of Kasoga. I know that he is the backbone of Kasoga, and sir is always so generous with his wisdom and his advice. And he really gets the whole organization running. Dr. Vidya Thobi, congratulations for being installed as the president. And I'm sure that under your leadership, the presidency is going to be one more feather, not only in yours, but in the Kasoga's cap also. I must also acknowledge and congratulate Dr. Rajeshri, Dr. Suman, and Dr.
Thank you, sir.
Shobha, who hold office in Kasoga, and thank everyone in Kasoga involved for calling me for this program. Let me also acknowledge our wonderful president and dear friend, Dr. Rishikesh Pai, and Dr. Madhuri Patel, the Secretary General, Dr. Alka Pandey, the Vice President of Foxy, and of course, the dynamo of the Safe Motherhood Committee, Dr. Preeti Kumar. I often used to tell Preeti that because of all the work that she's doing as a chairperson, for the first time I'll have to hire one staff in the office only to look after the Safe Motherhood Committee. And I'm delighted that Preeti has not slowed down. If anything, she has increased her pace of work. And Preeti, we are so happy that you are putting in all this kind of wonderful work and expect to see and hear more from you in the future. I'm also very happy that Dr. Sachin from USA, Dr. Harish from IP Global are present, as is Anupam from Jharkhand, and I can see Nivedita also. I had the good fortune of being in Bokaro the other day, thanks to Nivedita and her very kind invitation. Vistrit actually started, I think, almost in the throes of COVID, and the way it has gone forward is something which I hope other projects will emulate, and I am looking forward to Preeti and the entire federation taking this forward. And let me end again by congratulating Kasoga for taking up this initiative, and let's hope that it does help in a very concrete way. Thank you very much.
Thank you, sir. Thank you very much for sharing your views and giving your inputs. Thank you very much. Now I call upon Dr. Sachin to tell about reality bites of Foxy Vistrit in Jharkhand. Dr. Sachin Gupta is a public health specialist with over 20 years of experience in the field of public health. He works as a senior advisor for maternal, newborn and child health care with USAID India Mission. His areas of expertise include policy formulation, advocacy, project planning and management, implementation, capacity building, review and evaluation of maternal child health and immunization, and nutrition. Before joining USAID, Dr. Gupta worked in different capacities with various organizations, including WHO, UNICEF, and JSI, providing technical assistance to the Government of India, state governments, and partners to strengthen and improve maternal and child health care. I call upon Dr. Gupta to share his views and thoughts.
Thank you, madam. And that was really a very generous and long introduction. I don't have those many words to say today, but really thank you so much. And I am really thrilled to see my teacher, Dr. M.G. Hiremat here once again, along with the whole leadership of KMC. So Dr. Hiremat was my teacher at KMC Hubli, and all that I know today about maternal health, actually, it's because of his blessings. I'm able to actually lead whatever I can support today. So in terms of, I think, the United States Agency for International Development is concerned, I think we are really proud to have supported this initiative through partnership with Foxy, and private sector partnership is actually one of the domains, the primary domains of USAID's work in India. And by demonstrating the cost-effective and scalable and sustainable implementation models through strategic public-private partnerships such as this one, the Vistrit project with Foxy, we can further catalyze efforts to improve access to affordable quality healthcare services. And I think Foxy, as everybody said, has shown a great leadership under the able guidance of Dr. Preeti Kumar, and we are very humbly, very proud to have association with the Foxy team for demonstrating this model of quality improvement in antenatal care service delivery in the private sector. And also we know that there have been many efforts actually more focused on the intranatal care in the private sector through Manyata initiative, and the others in the public sector such as the Lakshya initiative. But the ANC had been a piece on the back burner till now, and we actually thought that ANC actually needs some quality improvement efforts, and there is really room to improve the quality of ANC in the private sector, also along with the public sector. And sir, actually, Hiremat sir asked a very pertinent question: why only anemia and GDM? And also, actually, sir, this was the start of the project, and we thought that we can take limited kind of let us bite in the beginning as much as we can chew, and definitely we want to actually further the initiative to take more domains of antenatal care and just not limit ourselves to the two initiatives. And I am hopeful that with the efforts of the KSOGA, definitely we can demonstrate the model beyond these initiatives in the Karnataka state. So I think without saying much and without taking much time and without further ado, I'll hand over to Dr. Harish, who can talk about some of the practical aspects of implementing this program in Jharkhand. And the overall learning from this project actually has been very great. And not only just the improvement in the knowledge of the healthcare providers, but also the companionship and the relationships and the team building and improved communication that led actually to the improved patient relationships also. And also Dr. Jaideep Tank mentioned about the COVID-19 pandemic. So we all know that COVID also has further highlighted the need and relevance of remote training. And this project also provides us those kind of opportunities where we can provide the remote trainings beyond the face-to-face trainings. So I think I'll just once again thank everyone from Foxy team, especially Dr. Hiremat, and I hope to visit Hubli sometimes in near future and meet him in person. Over to Dr. Harish. Thank you so much.
Thank you, Dr. Sachin. Now to introduce Dr. Harish Kumar. Dr. Harish Kumar is a public health pediatrician, has over 35 years of diverse work experience with government, United Nations, and other development partners. He has worked as intensivist in large hospitals, supported the development of national guidelines and training packages. He has more than 30 scientific publications. He has played a pivotal role in providing strategic guidance, implementation, oversight to various projects, including the current USAID funded some way. He has extensive experience of healthcare system strengthening and government partnerships at the national and state level, and has special expertise in solution development and identify opportunities for innovation and system changes. His work enabled India in starting many key innovative works, such as newer pneumonia diagnostics, family participatory care, evidence-based health work plan development, etc. Over to you, sir. Dr. Harish, sir.
Sir, unmute.
Dr. Harish, sir. Are you there?
He's there.
Sir, not
He is
audible.
unmuted. Welcome, sir.
Sir, you're not audible.
He's there.
Dr. Harish, can you connect us?
Dr. Rangalakshmi, please. Yeah.
Dr. Harish, can you connect us?
He was seen just now.
Yeah,
we
he
have
was there,
seen him.
madam.
He was,
Mm.
he was here.
I think I will call him.
I think we can, Shobha, you can take the comments from Dr. Anupam. In the meantime, he will join.
Okay. Now I call upon Dr. Anupam Singh to share her views on the Jharkhand experience. Dr. Anupam Singh.
Thank you, ma'am. A very good evening to all the esteemed dignitaries present on this virtual dais and to all those who are connected today on this virtual platform. First of all, a very happy, National Safe Motherhood Day to all of you. And I would begin by extending my heartfelt thanks to Madam Dr. Preeti Kumar and the organizers for giving me this wonderful opportunity to share my experiences with you all. I consider myself extremely fortunate to be a part of Project Vistrit. I was involved with this in this project at in various capacities. Like I was a mentee, I was a mentor, as well as I was a peer assessor for the enrolled facilities there. So my experience was really wonderful with this project. It was a fantastically curated project which took into consideration both the doctors as well as the healthcare workers. So actually what I found initially was that there was a considerable gap in terms of updated knowledge as well as practices. So as we went ahead with the training and mentoring programs, so what actually went up was that there was a gradual upscaling of skills as well as practices for healthcare workers as well as for the doctors. And for facilities like mine, which mostly caters to peripheral population of lower socioeconomic profile, this was pretty much like a boon in disguise. So we could do a better categorization of anemia, and we could, in fact, institute appropriate management, appropriate treatment for all those patients. And as earlier, we never realized that the incidence of GDM was so high in our geography. It wasn't that it suddenly, we started picking up more number of GDM cases. Not that this incidence suddenly went up, but all because we started following OGTT screening very religiously, which although we knew, but it was not much into practice. So actually knowing what is the standard and practicing what is standard, there's a difference. And Vistrit project has actually played a phenomenal role in this regard. It had actually bridged that gap of what the standard which we knew as well as the standard which we practiced. So I think there were so many, and there was another important thing where we found a very remarkable improvement that was at the level of counseling. Counseling improved remarkably. Our healthcare workers felt so empowered, and during the training that they were so confident about counseling. In fact, they practiced it so religiously that we could, in fact, see the difference in how they were earlier and how they became after the training. So, moreover, there was the data collection to send the monthly, we used to send monthly, we still send monthly progress report. And for that, data collection was essential. This data collection also gave us an idea that how prevalent GDM was in our geography. Somehow we could not figure out earlier, but after this project Vistrit happened, we started knowing how common it was and how well we could manage it. So that's why I think incorporation of all these correct practices, it not only increased the confidence, it also boosted the morale of both the doctors as well as healthcare workers. So all in all, what I feel is that it was a win-win situation for me, my healthcare workers, as well as my facility. I extend my heartfelt thanks to all the collaborating partners who had actually helped us throughout the project and helped us sail through this anemia and GDM. So that's how I conclude. Thank you very much.
Thank you very much, Dr. Anupam Singh, for sharing your experience with Vistrit. Dr. Harish, are you there? Dr. Harish, sir?
Yes, he is there. Sir, you're not audible. Can you join with phone, sir?
Am I audible now?
Yes, sir, you're audible.
Yes, 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 sir.
Uh, Thank you. And it's indeed my proud privilege to be amongst a galaxy of experts from Foxy. And thanks a lot, Dr. Shobha, for very wonderful and very kind introduction you gave about me. In fact, when I recall the days when we started about this visit, it was COVID time. I had recently taken over as project director for Vritti. Vritti had the proud distinction of being a partner at the national level for starting Lakshya. And one of the prime mandate which was given to us was starting innovative solutions. The only missing component amongst that was, while we had started successfully so many things like family-centered care, neo-diagnostic devices. Prior to that, I had worked with Norway India partnership and had brought in many solutions in the country, including IMNCI. With USAID support, we converted that into EIMNCI. But the main thing which was hurting was that if we have to achieve universal health coverage, involving private sector is not a luxury but a necessity. And there cannot be a better organization than Foxy to lead this. Dr. P.T. Kumar, we were all actually astonished to see the kind of energy she brings, the kind of leadership quality she showed in, and the quickly she moved into the discussions when we started. We used to have long meetings with Dr. Jayadev Tong helping us and clinching this work. There's a saying, "Ye dil mange mo," and I heard many speakers saying, "Why didn't we include hypertensive diseases?" Others might say, "Oh, why didn't we include postnatal care?" There are so many important things. We all know there are multiple facets to the maternal mortality, but I had worked in the past as WHO focal point for MNCH in Bangladesh, and we used to feel ashamed the kind of anemia we have in India. So we thought, let's begin with a humble beginning. It was COVID time and a real difficult time. We set a very challenging task in front of us, that involving private sector, getting their baseline assessment, looking at what is it? Because having come from medical background myself, with my wife being a gynecologist and my daughter-in-law also a gynecology practicing person, it's not that the private practitioners, they lack knowledge. It is also not that they don't have the equipment. It's something else is missing, and we wanted to find out that. And together with Priti, we decided we'll enroll some of the willing places. And as mentioned, some of the weaker ingredients included that they didn't have the counseling skills. They couldn't really keep themselves updated, having got into the busy life of practice with the latest possible recommendation. And our project with USAID, Sachin supporting us so well from USAID, kept a target that, okay, let's take the best practices from the public sector to the private sector and bring in few of the best practices of the private sector to public sector. Just to give you an example, recently we started a carbitocin initiative, which has been one of the better practices in the private sector, and we are trying to bring it in the public sector, and we have started work in Devas, MP. But continuing with Westrid, we thought, let's start with just a couple of most important entities. Anemia, having gone through NFHS 3, NFHS 4, and now NFHS 5 have come. But we knew that this is not such an easy thing, even though for a medical practitioner, it looks quite easy that I have to prescribe oral iron, I have to give deworming agent, I may have to give injectable iron or maybe blood transfusion. But how to get it into the population level? That was the challenge, and without involving almost every kind of private sector facility. Because private facility is very, very diverse in India today. Having just an outpatient clinic or a place where deliveries are conducted to a multi-speciality units, which can talk about even getting B12 and folic acid and other levels done in no time. So with that, we started the work. We did a baseline assessment. Several tools were prepared. Preeti took so many, I'll say, thankless hours burning midnight oil to meet the timelines of just 2 to 3 months to complete every work within the time of the project, because Vritti was towards its fag end. And we wanted to have a end-line analysis also to see as to what have been the gains. Whenever we start working with USAID, having come from the government sector and having worked with so many agencies, every development partner who spends his money wants to see that whether it is sustainable or not. And today, I believe, is a red letter day when it has gone beyond Jharkhand to other states. We can always expand it as per the logo of IP Global, enriching lives and expanding horizons and keeping sustainability so that we can take it beyond the limit. And I'll say that unless we take it to a sustainable limits, making everybody together in the country not succeed. And it is an era, unless partnerships are done, will not be able to complete the task. Thank you. And I'm again really, really thankful to Dr. Preeti Kumar, Dr. Jaidev, and so many other dignitaries that I'll be feeling in my duty if I name only few of you. But thanks a lot from the core of the heart.
Thank you, Harish ji, for joining. Thank you.
We'll continue working together. Thank you.
Yes. Thank you.
Thank you very much, Dr. Harish.
Thank you, sir. Thank you so much.
Now I call upon Dr. Preeti Kumar. Madam is the dynamic chairperson of Safe Motherhood Committee, FOXY. She is also the co-chair Maternal and Perinatal Committee, Suffolk. She is a committee member of MFM Committee, AFOG. She is a professor and head Department of Obstetrics and Gynec, Narayana Institute of Medical Sciences, Kanpur. She has organized many great conferences like UPCOG 2023, AICOG 2020, and Gestosis 2019. She was the vice president of Lucknow Obstetric and Gynec Society. She is a core member of Prevention of Violence Against Women, and she has won many prizes.
Thank you so much,
madam.
Thank you. Can you stop sharing the screen so that I can share my screen?
Yeah.
Yeah, thank you so much. Thank you, Dr. M.G. Hiramat, sir. Dr. Hema Divakar, I think she is my true inspiration, and I must tell you whatever I'm doing is just because of her. And thank you, Dr. Hema. Your blessings are always needed. Thank you, Dr. Vidya, Dr. Rashri, and Shobha for taking pains and for starting this wonderful initiative, Foxy Viscare. I would be failing in my duty if I don't thank the past president of Foxy, Dr. Alpesh Gandhiji, Dr. Shanta Kumari, and of course, the present president, Dr. Rishikesh Pai, because this project continued for 2 terms. And of course, Dr. Madhuri Patel, the Secretary General of Foxy, and Dr. Jaideep Tank, who was the sitting Secretary General when we started this project. I'm so grateful to USAID team, especially Dr. Sachin and Dr. Moni, and also Dr. Harish, because we were also very desperate to start this project and we did not have much funds to start this project. So Jharkhand was an area where much was needed as far as the maternal health was concerned. But definitely we had the timeline of 4 months only. And it started in December and it was supposed to be finished in April. And we were given targets so that we can get some amount from IP Global. So when we created the tools, we got some amount. When we created the modules, we got some amount. So we were given the targets. So regarding the Dr. M.G. Hiramat sir's question why I took only 2 anemia and GDM as a component for the training, because I still remember when Dr. Hema Divakar was assessing one of the center, she said, I think Preeti, this is the perfect center for, she was assessing on GDM and anemia. She said, Preeti, it is good that you took just 2 entities and you made all those 30 facilities so perfect in the management of anemia that now they can manage it so well. If you take so many components, like we had this in Tainalam. So we did this in Trichy, and we took several components like cardiomyopathy, hypertensive disorders, anemia, and GDM. Believe me, it was not a very good experience for us. So I will share a few slides just to give you an idea. And I would express the gratitude to my team members of Safe Motherhood Committee, because whatever is possible is just because of the team, which is really working very hard, and I take the credit of it. So thank you so much. Many of us, of the members of the Safe Motherhood Committee, have joined also, and they are very eager to start this project. So let me share my screen. Shobha, you have to work hard for this. Can you see my slides?
Yes, madam, we can see.
So this is a presentation which I made for Kasoga, just to give you an idea how this project started. This was Foxy Vistrit initiative in Jharkhand, and this was done by Safe Motherhood Committee Foxy, of course, with the support of USAID. They funded IP Global, Vriddhi, for the project Vriddhi, and Vriddhi then supported Foxy for this project in Jharkhand. So it was like a blended on-site and tele-mentoring support for strengthening the quality of care in the private health facilities on anemia and GDM. So choice of intervention, how, because Dr. Vidya was asking how you selected the facilities, it was just first on, because Dr. Nivedita was the coordinator for Jharkhand. She had put this message in the group. So whosoever opted first was taken up for the training program. So most of the centers were Manita centers also. These two interventions are relatively easy to diagnose, but there are a lot of challenges regarding the counseling, because this is beyond something like drugs. There is a lot of role on counseling, and we can just train the healthcare workers on the components of the management of anemia and GDM. So main objective was build capacity of healthcare providers, both doctors and nursing staff, and standardize the care of GDM and iron deficiency anemia, and strengthen innovative and replicable training modules and modalities, and strengthening the infrastructure capacities, including the equipment and IC material. So regarding the methodology, there were 34 private sector facilities which were enrolled: Bokaro, Girdi, Ramgarh, Ranchi, and Jamshedpur. These were in the domain of USAID and Vriddhi, but we took 3 or 4 facilities from Dhanbad also, because they were very eager to get enrolled for this project. So we just took almost 34 facilities, 40 doctors were there, and 270 healthcare workers were enrolled. We took the letter of intent from those facilities that this is without any charges, and you will be involved in the training, you will be sharing your data with us, and you will not drop out from the training programs. So this is a kind of a pre-training survey that we did for the healthcare workers, and similarly we did it for the doctors. And most of the survey for the healthcare workers were done on site. It was physical assessment, so that we can know exactly how much they know. And for the doctors, we created the Google form to get the idea. So questions were different for the doctors, but almost on the same lines, what we wanted to teach to the healthcare workers. So then we started with the training program. So some of these sessions were online, and since it was a COVID time, and then we had one program officer in Jharkhand, and Dr. Nivedita was instrumental along with Dr. Anupam and Archana. And they also did a lot of on-site trainings for GDM and looking at the infrastructure and how they are counseling, whether they are maintaining the record. And also this all was done on-site as well as online. So these were the kind of modules that we did, like defining anemia, diagnosis of anemia, management of anemia, postpartum anemia. And we had several modules for the doctors, different modules for the healthcare workers and different modules for the doctors. Now, assessment, we had different modalities. Like sometimes we used to do panels also in between for the doctors, also for the healthcare workers, just to know how much they are learning from the training program. So these are the kinds of charts that we created. These are all formed by Safe Motherhood Committee Foxy. So this was all made in Hindi, and these were given to all the facilities. And as you can see, they are holding one book in their hand. So this was a kind of a logbook that we created. And we requested those healthcare workers to write 5 cases of anemia and 5 cases of GDM, whatever they are saying and however they are monitoring and counseling. So just write it down on that case sheet. And as you can also see small yellow booklet also with them. So this is again a small handbook which was created for anemia and GDM. So I'll request Dr. Vidya and Dr. Shobha to translate it in Kannada. I'll give you, this is in Hindi, you can translate, very good handbook that they can also read and tell to the patients, very simple to understand. So these are the things that IC material that we gave it to the healthcare facilities. Now, as you can see, this logbook, this is the logbook, every healthcare 270, and this all was funded by USAID. So we printed all those things. And as we used to write in the internship, the case sheets in the maternity ward, similarly, they were asked to write 5 cases of anemia and 5 cases of GDM. And beautifully, they have maintained the logbook. This was a new thing that really made a huge impact in the training process. So mentoring was again done by doctors of the facility. Like Anupam said, she had different roles to play. So the doctor of the facility trained their own healthcare workers. Then cross mentoring was done, like doctor of one facility trained the healthcare workers of the other facility, and then members of the Safe Motherhood Committee and program officers. So mentoring was done in a different way. So now coming to the analysis, as you can see, these are the charts. The orange one shows the pre-training data and the green one shows the post-training data. So I will share this, Shobha, with you and Dr. Vidya. You can just go through this because it is very difficult to read each and every component of anemia. Very simple thing. What are the signs and symptoms? If you see the first one, all are signs and symptoms of mild to moderate anemia, except, so you can see 14% answered the correct one. So after the training, 100% offered this. So how you screen it, which test you do. So most of them wrote hemoglobin. They were not doing CBC. These are small things that you need to be corrected in these facilities. How you give iron, how you supplement, what are the iron enhancers. So these are the simple things which are there. And as you can see, the pre-training and the post-training analysis. Now, this is the another way of presenting the data, the point difference. You can see the red bars on the side. That is basically the difference that made after the training programs were done. So these are the different questions that were asked, and again, the assessment was done, and this was the change in their knowledge, attitude, and practices after the training program. So similarly, this is for the a major chart that we made for when to test and what are the severity values for the hemoglobin, when you call it mild, moderate, severe, whether you are deworming, iron-rich diet, enhancers of iron absorption. So different ways we projected the data. We have the complete analysis report, which was submitted to USAID. So similarly, this is the another graphic presentation where the mean score was 91.5%, the minimum score being 80%, and maximum was 100% for the standards of anemia. Coming to the GDM, again, there was a significant percentage point difference in the knowledge seen after the training programs in the healthcare workers. As you can see, how long do you follow after delivery? So only 10.6% were following after the delivery. After the training, 82%, the difference was 82.9%. Very simple test, how you do the testing of, how you do OGTT. This was again a huge gap in the Jharkhand. So I will share all these data with you so that you can have an idea and you can modify the questions if you want. So we have all those pre-training survey forms, but if you want to add or delete something, you can very well do it before doing the pre-training survey. So this is all the graphical representation bar, when to test, how to test, cutoff values. As you can see, the blue bar, it's just 30%. So they were not aware actually 140 is the cutoff for the GDM diagnosis. So these are small things that really made a huge difference after the training program. And again, the similar thing, the minimum score, something between 80 to 40 to 100% before and after training. So most of the facilities they scored. Now this is a facility-wise scoring chart. So this is, you have to make, Shobha, whatever facilities you're selecting, you have to make the scoring chart that how much is the difference, what is the score after the assessment after doing the training programs. So it is basically to establish the quality of standards for the care of pregnant women in the diagnostic methods, normal and abnormal values, management protocols. Counseling made a huge difference in the healthcare workers and follow-up of mother and baby. Then again, an audit system was created and they started maintaining the records of anemia and also GDM in their healthcare facility. So post-training, it was 100% awareness about the disease, the diagnostic criteria, the methods, and the counseling and management. Providership from doctors to the healthcare workers. This was again very, very important. Change in the practice behavior of doctors and the healthcare workers, and spurt, as Anupam said, spurt in the detection of GDM cases and improve maternal and perinatal outcomes. So impact on healthcare workers was on knowledge, attitude, and behavior, increased zeal and drive to learn, improved knowledge of clinical signs and symptoms, and respondents observed an increased sincerity and respect towards their profession in contrast to the casual attitude they had before. So again, counseling skill enhanced. Healthcare workers have adopted the new guidelines, and they really had, we have a lot of feedbacks. We did record these statements. Even USAID did the closed group discussion with the healthcare workers and the doctors, and where we were not allowed to sit in that meeting. And all of them gave wonderful, response. So this is a kind of a monthly progress report, which we requested from all the healthcare facilities, which we trained. Very simple format: how many anemia cases, how mild, moderate, severe, how many GDM cases, whether they were positive in the first screen or in the second screen. So this kind of a monthly progress form we gave to all the healthcare facilities. And then appreciation from all the participants. We got appreciation at Foxy level also. We got appreciation then from all the clients also. They gave the response has improved. And USAID and IP Global and Vidhi also, appreciated our work, as Dr. Harish was mentioning. And at the end, we gave them this certificate of participation, as you can see, and they were very, very happy to receive this certificate. It was just a certificate of participation that they have been trained for 4 months on management of anemia and GDM. And at the end, we got this letter from USAID, where Ms. Sangeeta Patel, the country director of USAID, she wrote this letter of appreciation for partnership to improve maternal care at Bistrit at Jharkhand. So this was again an inspiration for the entire team. And lot of, these are feedbacks from the assessors. There are feedbacks from the facility in charges. They gave their comments how impressed they were with the training, and they wanted more such trainings on different aspects of the maternal health. So we have a number of media coverage also in Jharkhand. So this, as you can see, there was a lot of media coverage for this project, and this made a huge buzz in Jharkhand. So it's basically what Winston Churchill has said, that it's only the continuous effort that makes a huge difference. You have to have a way forward, and you have to make a continuous effort. So I'm very happy today because we are launching 2 projects. One is at Fatehpur. It's a small district, 200 kilometers from Lucknow, where almost 1,200 deliveries are occurring in the private sector, and totally unregulated private sector, where 30% of the maternal data is not reported to NHM, and Safe Motherhood Committee has taken the responsibility of training those facilities, and we have named that project as Jeevant. So today morning we had the launch of Jeevant, where the government of quality, Dr. Archana Verma, GM Quality Assurance, she was part of that project. She was there during the inauguration, and CMO of Fatehpur. So we have taken 2 districts in UP. One is Sitapur and district Fatehpur. We want to create a model because these are not OBGYNs. They are some are Ayush doctors, some are untrained doctors, which are, healthcare workers who are conducting the delivery. So we want to train them at actually whatever they are doing. We have to train them whosoever is providing the maternal health, because most of the surgeons are providing there. Fatehpur district has only 4 trained OBGYNs, the qualified 4 OBGYNs. Rest all are not trained. So this we have taken as challenge. It's almost 200 kilometers. The roads are also not good. But today we launched it. Let us see how much we can do it. And definitely we'll try to collect the data from Fatehpur and Sitapur, and probably because we still have the maternal mortality of 167 in UP. So it will take a long time to bring down the maternal mortality. But as long as I'm there as a chairperson, Safe Motherhood Committee, Foxy, and as much as I can do it, I will certainly do it and put my best. Thank you so much.
Congratulations, Preeti, for
Thank
the
you.
excellent presentation and
Thanks. wonderful
documentation.
Yes.
And documentation of everything is so wonderful that it will stimulate everyone to do this work.
Sir, we have sent this for publication in our own journal. because it is
Yes.
Foxy's work. So I did not want to put it somewhere else in other journals. So I have put it in Yogi, and I'm waiting just for the, I think hopefully it will be published soon in the Journal of Obs and Gynae of India.
Great, great.
Thank you so much, sir.
Madam, that was a very inspiring talk, and you have really inspired us to do very well in this section. I hope by the end of our tenure, Karnataka's maternal mortality will be equal to Kerala's. We're so much inspired by you. Now, I welcome Sheila Mane Madam, who has joined just now. Welcome, Sheila Mane Madam. Now I call upon our dynamic secretary, Dr. Rajashri Paladi Madam. Madam is the Director of Aditya Hospital and Professor and former HOD, Department of OBG, KBN University, Gulbarga, Karnataka. She was the chairperson of Genetics and Fetal Medicine Committee, Kasoga, President of Kalburgi Obstetric Gynecology Society. She's the Vice President of Rotary, and she has been a PG examiner and UG examiner and a avid teacher who takes a lot of pride in teaching students. Madam, over to you now to talk about introduction to the Vistrit Kasoga project.
Pranamam, everybody. Thank you, Shobha, for the kind words of introduction. It's indeed, I'm fortunate to be associated with all the stalwarts of Foxy today to be starting a program called Vistrit in Karnataka. This is like providing the antenatal care and the clinic which started way back in the late 19th century, from wherein the structured care for the obstetrics started. We are going back to the grassroots because the grassroots problem do exist, and my due respects to the patron of Kasoga, Dr. M.G. Remat sir, Dr. Hema Divakar ma'am, and it's so wonderful to be working under the dynamic leadership of Dr. Vidya Thobi ma'am, who is the president, and all the stalwarts of the National Foxy, Dr. Preeti, the chairperson of Safe Motherhood Committee, who has taken such a wonderful task to start and who has been a role model and inspiration to do much more, like taking up a district wherein only 4 obstetricians are there. Come on, do we exist in the tenure wherein we are still providing obstetric care in India? So that is how the scene is in the grassroots levels. And it is indeed a challenge that anemia, which is the mother of all diseases of obstetrics, be it PPH, be it hypertensive disorders, and so many other disorders directly connected to anemia. It is still unfortunate that in spite of the 6 decades spent to improve the condition of anemia in the nation, we are still in the pathetic state wherein many lives are lost. The maternal mortality continues to exist, although we have achieved a reasonable target of reducing by, say, 7 or 8% by 2018 from 2013, but still a large needs to be done in terms of providing safe healthcare provisions to the women, and definitely with the model set in by Dr. Preeti and under the able leadership of all the USID concerned authorities like Dr. Sachin, and with the guidance of Dr. Anupam Singh, we are sure that we would be able to achieve the target. And I heartily congratulate Dr. Vidya Thobi ma'am for spearheading this program and bringing it to Karnataka in the Safe Motherhood Committee. And we know that a lot has to be done, and definitely we will do. And this is just not a 1 year or a 2 year tenure that exists. And thanks to the Zoom, thanks to the, in fact, COVID, that the Zoom has come in, and the COVID has helped us to connect each other and share the views and opinions and formulate the rules and regulations to reach to the core of the society, we the women, for the women, standing by the woman, for the betterment of the woman. And I'm sure that in this tenure of 1 year, 2 years, whatever years to come, that we will be able to percolate the substance of our intent of helping the mothers at the grassroots levels. And definitely in the coming time, we will formulate and be able to select the facilities or the setups wherein this can be much more meaningful, rather than having a place wherein already there are trained people working like the medical colleges. And I'm sure that the people here who are so wonderful, who are so dedicated, and who are so divine, that they have sacrificed everything, and they have been able to reach out to do the best for what we have meant to be the obstetrician, to save the mother. And I'm thankful for having you all here on board, and definitely we'll do the best. And Dr. Vidya Madam has her own ideas and plans. She will be able to tell us more about how we are going to work under this Vistrit program. Thank you so much for the kind opportunity given to me. Over to you, ma'am.
Thank you, madam. Thank you very much for sharing your ideas for the Vistrit in Karnataka. Now, I call upon Dr. Vidya Tobbi, madam, our energetic and a person with lot of zeal, our new president. Madam is the president, current president of Kasoga. She is a professor and head of Department Obstetrics and Gynecology, Al-Amin Medical College. She was the chairperson of Food, Drugs and Medico-Surgical Equipment Committee. She won Best Committee Foxy Award. ICOG Governing Council member. She has won Foxy Champion Award, and she has been a part of many journals, and she has arranged many conferences. She has been president and secretary of Bijapur OBG Society. She has got many publications in her name. She is a very great UG and PG teacher, and she has been an examiner for PG and UG examinations, PG students. Madam, over to you to share your ideas and dream for Vistrit in Karnataka.
Namaskara. Very good evening to one and all. And really, I'm very, very thankful that I could launch this program today on that Safe Motherhood Day. And this is my first program, and I always believe in working at the grassroots level. Instead of, even though I'm a professor in a college, I love to work at the grassroots level to achieve the result. There are various dignitaries. There are so many leaders of Kasoga and Foxy who have guided me throughout my journey, and I'm really blessed to lead Karnataka in this. And I must say that I will do something better for the motherhood and mothers of India, or whatever we say. So thank you, Dr. M.G. Remet sir, Dr. Hema Divakar, and of course, Dr. Sheila Mane had joined, who was a past Safe Motherhood Committee of Foxy and Vice President of Foxy, and she has done wonderful work as a Safe Motherhood Committee. So she has done so much, and she is called Lady PPH also. So she has also joined, and really with these leaders, definitely we will put some footprints in the safety of our mothers. So as I was talking with Dr. Preeti, and we wanted to launch this long before the Jeevan Dhara project, but we could not. Then we thought of launching this program, that is Vistrit. And this is really for Karnataka, those who have joined. Now, many of the people could not join because they are doing the programs at their own societies, the Safe Motherhood programs, and they're sending the photos also. Few of them, they have joined, and already when I put the flyers, so many facilities they have inquired. I think Shobha has got the list also. So it is so popular, and people really wants to learn. And really they want to train their healthcare workers. So that shows that people need the skill enhancement of various obstetric care providers. I have my slides if Arun can share, otherwise I can talk like this only. So this program is mainly the on-site and tele-mentoring support, as Dr. Preeti was talking. And we are dealing with mainly two things, that is anemia as well as gestational diabetes. You can go on moving slides, Arun, because I'm just talking like that. So you just move the slides one by one. Okay. So Kasoga is an organization, and we are a team actually, and there are more than 20 societies. 3 more societies are going to join. So there are more than 3,000 members, 3,150 or so, and all OBGYNs together really can play a miracle. So if you see the Karnataka health profile, there are almost 30 districts. And generally, if we see the information, there are a number of districts are 30. There are so many talukas, so many villages, so many health facilities. And it has got a mixed healthcare system with public and private healthcare providers. So there are many surveys they have taken up, and they say that around 65% hospitalization where they are treated by the private sector hospitals. And so private sector contributes to nearly half of all the deliveries. But as Dr. Preeti has pointed out, these private hospitals are largely unregulated with no standardization of quality of services, where we have to address. So anemia and GDM, there are two major causes of maternal and neonatal mortality and morbidity, so that we are going to address these two. And we want to focus on the capacity building for ensuring the quality of care. So these are the two things we want to have the interventions. I will not go into the theory part. We have always discussed why the anemia is there. Anemia is a killer, and GDM, why we have to screen. I just want to point out some of the things in the Karnataka. Though the Karnataka shows the recent survey, it has the maternal mortality ratio has gone to 83. And in Kerala is 30. So we have to achieve that. But what about this is a mortality ratio. What about the morbidity? So mainly the diabetes and anemia, these are the few of the things one has to tackle. If you see this, next slide, please. So most of the antenatal patients, Arun, please make the next slide, this one. So you can see here, the most of the antenatal patients are registered, and most of them, they are attending in the first trimester itself. So we have to screen in the first trimester, and we have to sensitize our healthcare workers and doctors in Karnataka. So this is a Karnataka Directorate of Family Health Welfare Service. From there, this data is there. So we all know what are the antenatal best practice protocols. There are various GCPRs which are published, when to do hemoglobin estimation, when to repeat this hemoglobin estimation, and what dietary assessment and corrections to be offered at the booking. All those things we know, but somewhere something is we are missing. Even we know the impact of GDM on maternal and child health also. And when to screen, what things we should use. The calibration of whatever we are using, the checking instrument which is available at periphery. I have just checked, they are not working. They are just doing random blood sugars at our urban health centers. I have visited so many urban health centers or primary health centers. They are not using the proper instrument for hemoglobin checkup, as well as the calibrated AccuChecks. So these are not used. So there are so many gaps one has to address. Although doctors are aware about the screening, diagnosis, or management, basically they should be trained together for better coordination. So this little bit survey what I did in the our North Karnataka, I felt that there is a need to bring this Visit project to Karnataka. So there are 4 zones, as all of us know, and Dr. Shobha also knows. She has to take around 4 zonal coordinator under her, and they should be like strong.
Madam, you are not
workers.
audible.
Yeah, I'm not audible.
No, go ahead.
Vidya, madam.
Yeah. I'm just
No, we
talking.
can-
He
we
is
can
not
hear you,
moving
yeah.
his slides. He is not moving. I am just talking. I'm just talking. Let it be. Slides. He is not moving. Let him move as he wants, because he will not know this one also. People are listening. I'm happy. So I want Dr. Shobha as a leader. And I want to bring in our past Safe Motherhood Committee Chair, Dr. Sonia. She has also done very wonderful work at her place. So as an advisory, she is there for the Safe Motherhood Committee. So these two can bring in the strong team, as Preeti has got very strong team, because I have gone as a online assessor for her Jharkhand various facilities. And I feel they are very dedicated. So that type of work we should do in Safe Motherhood Committee in Kasoga. We have to formulate a core team. We have got great leaders like M.G. Ramat sir, then Hema Divakar, and so many people. So we have to have such a core team. So one team is from Foxy, that is Safe Motherhood committee Foxy, we have Preeti Kumar, we have got Nivedita Datta, we have got Anupam. So many people for the Foxy. She has, means as a leader, she has trained so many people, and they themselves have got so much inspiration to do work. So such type of team I hope and I must have in Kasoga. And we will formulate the core committee for guiding these people. So this visit is a knowledge updating and translating into the improvement practices in anemia and gestational diabetes mellitus. So few people have joined, like I must mention here Dr. Surekha from Haveri. She immediately called me and she told me, no, we have to take up immediately. She gave 3-4 numbers, 10 healthcare workers with their mobile numbers, their everything, email ID, everything she has provided. So much zeal is there in our society members, and one should definitely adhere to the various work one can do in Karnataka. So the objective already Preeti has mentioned. What are the objective of this visit project? One is capacity building, standardization of the care, and the most important is that this visit is innovative and replicable training modality. And even it strengthens the infrastructure capacities, the equipment, and they're providing so much IEC material. And it is a focused training. It is also training of doctors and healthcare workers. And it also gives some of the management interventions, like major nutritional interventions. And apart from detection, the most important part is what I feel in this visit project is a counseling part. I feel this communication skill and counseling should also we should take up, and I think in my tenure, some part of my tenure, I want to give this counseling and communications skill much highlight. The mode of training definitely is online, and as Preeti was telling, we will definitely, she will be providing us material, and we are going to translate this material into Kannada. And this continuation of training is by mentorship, and definitely we are going to plug the gaps in between. Most important is how we are going to choose the facility. Already now 15 facilities have called us and they want to enroll. Now, what are the prerequisites? I just want to tell everyone who have joined here from Karnataka, facilities should be in compliance with all relevant statutory requirement of Government of India, one thing. And it should be willing to conduct necessary reorganization of service areas, infrastructure, information display should be there, and any important service area improvement. So whatever our Kasoga assessor or the who will be training them, their idea should be taken positively and they should be able to improve themselves. Then staff, managers, clinicians should be available for training or capacity building program. That is the second one. Third one is willing to provide the access to the representative of Foxy, Kasoga, Safe Motherhood Committee members. Willing to meet the relevant deliverable as per the program implementation in a scheduled time. So we will give the time, we will train, there will be training of trainers, there will be assessor, there will be a proper protocol. So these protocols should be adhered, and accepting to maintain a dashboard of indicators and regularly this should be reviewed and share with the project stakeholders. So consenting to share a data, again, we are getting some data generator out of it. And this should be including the hospital, maybe for dissemination or publication. So you have to give the consent, whatever data we are generating, maybe it will be anonymous if you want, but that should be done. So first step is recruitment of facilities. So first, these people have already joined, means Bidar, Hassan, Ilkal, Gadag, Raichur, Bijapur and Bagalkot. These are the districts. Once we have put the flyer, so many inquiries and already they have enrolled. And there will be baseline assessment. Next step will be, then there is a knowledge gap assessment. There will be pre-test, post-test. The training will be virtual. It will be module based on Government of India and Foxy guidelines. The material, IEC material will be given, posters, booklets and logbooks. How to use that will be taught. There will be mentorship on-site or online, and there will be end-line assessment, that is comparison with baseline to assess the impact on the healthcare workers. Then, of course, there will be monthly progress report. So this will be the flow, how we are going ahead. So these are already enrolled facilities, and number of doctors, of course, I have not mentioned all, because yesterday only we launched and today we got these many. So we will be completing this, and then we will have another meeting. So these are the various doctors from Haveri, Bagalkot, Gadag, and of course Bijapur, Hassan. Bharti is already there. Bharti will enroll so many. And these are the various training modules and what all things we are going to proceed with this Visit project. Though these are the survey tools, already Dr. Preeti Kumar has already shared these survey tools, what are there, and these are the topics we are going to train for the doctors and healthcare workers. And these are the pictures from her presentation only. These are the on-site baseline assessment of healthcare workers, how it goes through, and the mentoring, how it takes place. Like a doctor of facility, there will be cross mentoring. Then these are the members of Safe Motherhood Committee of Karnataka as well as Foxy. There will be a program officer. So this team has to be very strong, I must say, and there will be cross mentoring also. The online assessment will be according to these standards, like GDM standards and anemia standards. I'll not go into the details of this, but definitely these will be the standards as I would like to mention. This is a sample of record book, and these are the pictures in Hindi, whatever the posters has to be posted outside your clinic. The logbook has to be mentioned, and as we know that we have to have some outputs when we teach these healthcare workers, what are the outputs. So these outputs will be anemia and diabetes in the diagnostic methods, but what are the normal, abnormal values, management protocols, then counseling and follow. And most important is one has to create an audit system. One is record keeping, documentation is very important, and the monthly progress report. So then we will find out what is the prevalence of anemia in urban, rural, and what is the prevalence of GDM. So these things we have to follow, and what are the use of how many of us really are using oral iron or injectable iron, which injectable iron, all these things we can mention. Then there will be a post-training also, post-training assessment also. So what about the awareness, the diagnostic criteria, diagnostic methods, and disease severity and counseling or management, what we can say. And what is a provider shift? And as how much GDM cases you're really detecting by universal screening. And the outcomes also we can mention, and record maintenance. So you can scroll down, Arun, till that Karnataka map comes. So still, yeah, next. So these are the 4 zones we can take up, and we can find out who can be trained there, who are a dedicated person to train. And we have got so many societies and so many energetic president and secretary. Okay, so in conclusion, this Visit project is about standardization of care. Second is robust capacity building program. And the third one is implementing, monitoring, and supervising effective care services. And I'm very glad that Preeti is here, and I assure her that we will get a good appreciation certificates from all the national leaders, as well as Foxy leaders, as well as Kasoga leaders. So I will join hands 100% with Preeti to save mothers, and let us strive hard let us pledge to serve the greatest creator, that is Mother. So these are the certificates which I have displayed from the Jharkhand, and this type of certificate we will issue through Kasoga and Foxy both. So at the end, I must thank our president, Dr. Rishikesh Pai, Dr. Madhuri Patel, and our chief patron, Dr. M.G. Hiremat, Dr. Hema Divakar, and all the past president of Kasoga and Foxy. And especially my thanks to Dr. Preeti. So just to scroll down, next slide. These 2 slides I just chose. So simple, she has put the questions. And many of these questions I asked to my healthcare workers or my staff sister, they don't know anything, ABCD. So I thought of starting some of the mentoring of my medical college staff only. Means even though they are GNM and ANM trained, they will not know these questions. Just take up some of the questions and you ask tomorrow, you go to the hospital and ask, they will not know. So we have to start from our cleaning from our house only. So that's what I must say. Thank you very much. And thank you, this collaboration to ensure the safe motherhood, I must say. Thank you, Preeti, for launching this important project in Karnataka. It is really eye-opener. And we start with GDM and anemia, and definitely we are doing some of the other life-saving workshops also, critical care workshops. I am planning to do so. And of course, the PPH and other causes which are major killers of mother, that continues. So thank you very much. Our journey to save mothers continue. Thank you.
Thank you very much,
Thank you.
Vidya madam. That was an excellent.
Shobha, I
Yes, sir,
have
yes,
some
sir.
questions to both of Dr. Preeti and also Dr. Vidya. As far as Karnataka is concerned, the leading cause of death in mother is hypertension. And my survey GDM, when Hema Divakar became the president of Foxy, I was in charge of North Karnataka. I did 800 cases, 400 in KMC in the institute and 400 in the private. And our GDM incidence was so low that in the government sector, it was 4%. And in the private sector, it was 8%. And we are living a major chunk, that is hypertensive disease in pregnancy. Now, my question is there any objection from Dr. Preeti to add up the hypertension also in this extensive training and extensive service program?
No, sir, there is no objection to it. But since Vistrit, we have taken the name, we can definitely add it because we are not being funded by anyone now.
Yeah,
so we
that's
have
what
to,
I
first
want.
is we have to raise our own fund. Number one, that would be the major challenge.
Yes.
What I can do
Yes.
is Vistrit, there was some fund which was left with Foxy because we could not do a proper physical dissemination at Ranchi. So that amount of fund is still with Foxy. So I will try to find out with Dr. Madhuri Patel and Dr. Rishikesh Pai that if we can use that fund for printing of all the IC material for
Yeah.
Kashoga.
Yeah.
Number one. Number two is I have saved some fund in Safe Motherhood Committee also. So
Yeah.
I would be very happy to contribute to Kashoga in whatever way possible because I have generated my own fund during last 2 years. I have not spent much, so that I can definitely give it to Kashoga. So I'll have to work out with Foxy because getting money from Foxy is again.
Yeah. See, my concern is when such a beautiful program you have devised, we are leaving a major chunk of the woman where
Yes,
the
sir.
mortality is very high because in our Karnataka Institute of Medical Science, we have got every month 1,000 deliveries.
Yes, sir. So
Out
you can.
of 1,000 deliveries, the number of cause for death is hypertension, that is preeclampsia and eclampsia.
Yes,
Unless
sir.
you cover that also, your overall mortality rate is not going to come down. For
Yes, sir.
example, when the
Yes,
GDM
sir.
is so less and concentrating that on so much, leaving out the hypertension, I feel it is little, may not be that much justifiable. If there is no any objection to add hypertension also, whenever we are training them for doing anemia detection, we can also make them to detect hypertension. You
Yes,
know
sir.
that when the hypertension is detected early and complications of the hypertension can be prevented. Nobody will get hypertension overnight. To develop PH, there will be a lot of time at our disposal. I think if that is also added, and this the program will have lot of impact in the outcome of the safe mother.
So like what we already have those standards and assessment criteria for anemia and GDM, then we have to work additionally for hypertensive also. That's the only thing because we are not getting any fund, we can definitely add it.
Yeah,
The second thing is, sir, the Kashoga has to make some timeline for the project. Like we have to start this project at this time and end it at this time. so that we can expand to other other areas also. So initially, I
Definitely.
requested Dr. Vidya to take maybe 25, 30 facilities, just roll those, start the project with the 25 to 30 facilities. Then we may, because the Jharkhand, we have several other challenges. Kasoga may we can add more things easily. So first you start with 25 to 30 facilities, have an idea, then you can definitely add on more facilities to that.
What I suggested, Dr. Shobha is the chairperson of the Safe Motherhood. I have told her to take one member from each society. We have now 23, 24 societies as a member, and entrust them that this is the work you are going to do for the committee. And by that you can add many more people, and our number also will be very high. And unless your data is very high, and you cannot say that this is the right data what you can have. So with so much of people involving, as rightly suggested by Dr. Vidya, we have got 4 zones. We can have a zonal, the monitoring. We can have a district monitoring. We can also have a society monitoring. I think this project can be taken in a very deep way. And ultimately at the end of the year or whatever time fixation we do, we can definitely show positive result. That is what I feel.
Yes, sir. Dr. Hema wanted to say something.
No, I lowered my hand because it was a point which you mentioned, Preeti, that it will take a couple of months to actually structure another module on hypertension. But we can also join, get some extracts from FOXY guidelines and the gestosis guidelines, at least a gestosis score and the correct measurement of BP and minimal things. So we can start like that just as an add-on to this, but it may not be as robust in the way that the structure of these two issues have been done, but we can certainly build over it, because anyhow we are spending our resources and gathering that group of people. Just one more module added on, and the assessment, etc., the way it is done for these two, we'll see at the end of 3 months whether we can already consolidate that also. So in your next phase, this could be your new blueprint for the other states, and we can expand it in that way, because this is time tested. 2 modules you have already given us. No need to reinvent the wheel, and it is ready. So to that extent, our burden is already decreased. So if a small core team works a little bit intensely about quickly adding on another, by the time they go through the first 4 and the next 4 talks, we can add on quickly the hypertension module, and we will draw help from your group to be the advisors for vetting out the nuances of the new module as well. And I think the point well taken, Dr. Hiramat, and as it is when we are all ready to work so much, just one more addition. And also I agree that complex and too many things we don't want to take up. But what he's suggesting is just one more important thing. Just one more important thing, which may not be too much to add, but it will make a lot of sense. Because, and also I agree with him about the GDM. We were challenging that 4%, because we said, how can it be? How can, but actually the North Karnataka diet, if you see, it is a role model diet. Those who are eating that kind of diet, who are coming to the public hospitals, have really already been on medical nutrition therapy. That is how it is. Whereas the other metros, even nearby, or private practitioners in the same areas, we have recorded very high data, 12% and above. So that is the stark difference. That is, we reflect back on the North Karnataka, and even the World Food Program, we have said that if you want a role modeling of the diet, you take it from our area here. So that's how it is. So I think this was a very, very fruitful meeting with everybody's, thinking and laying out this program at the start of the tenure in place. And now it only remains for us to walk the talk, and we will do.
Yes.
Thank you.
Hema,
Thank you.
Hema, I think the presentation, what you did during your presidency, your Bangalore, the GDM was 20%. When we presented from North Karnataka, your Bangalore GDM was more than 20%. And Tamil Nadu was almost 28%.
No, that actually that same percentage remains, Hiramat, even today in most geographies in the country, because as Preeti said, more and more, as Anupam also said, more and more are testing. So they are even in Hubli, your own center, when we did the WDF GDM project, they said that hardly we were testing 10 or 12% of our women, but when we scaled up to 100% testing, universal testing, they started escalating the numbers. Okay, so that is a reality, that metro and the change of lifestyle, the data is different, and the universal coverage will bring to light the actual incidents, and patchy data in many of the private centers are existing. So we are living with that reality, but no harm in instituting a good lifestyle, and in terms of exercise and nutrition, just universally, even FIGO, we are saying right across all age group, that is non-negotiable. Just get the lifestyle recommendations going in every segment, everywhere. No harm, but it will do a lot of good for these, change of data as such. So I think it's a very meaningful start.
It's only a small suggestion to include hypertension also, because it is the leading cause of death in the mothers.
I think, can I say what Dr. Hema suggested, justosis score, which is so easy. Most of it is history. Okay, one blood pressure checkup we will do, but that history itself gives us the score. So we know that who is in high risk, and from there on, I mean, those people also will be more vigilant, and those patients will be screened maybe more frequently. But Dr. Hiramat, I really agree with you that now it is the hypertension which is our concern now.
Actually, Dr.
Hypertension,
Shima, most of the healthcare workers are not aware actually how to take the blood pressure.
Blood pressure, from there we have to teach them.
Dr. Hema, same thing happened with PPH project in UP. Initially, the documentation was 5 to 6%, but when we did the project, it ranged from 12 to 22%. So the documentation increased after the training program. So a lot of things, of things happen. So I think hypertensive can be taken up, but I think initially to get some funds from the Foxy, let us keep it to anemia and GD, because we are linking with Vistrit. So I'll have to check with Foxy how much fund is there. So initially we'll start with anemia and GDM, and later on we can.
Preeti, you can call it as extended Vistrit.
Extended Vistrit, yes.
Thank you for sharing the funds also. Thank you.
Let me check with Foxy. I'm not committing right now, but I'll try my best.
Yes. For IEC material, at least.
I talked to USAID also yesterday and IP Global. So they said they will get back to me. Let us see how best they can also support for this.
So I must say that today was a very fruitful day, and it is a safe motherhood day. So thank you very much from my side.
Dr. Nivedita wants to say something.
Nivedita.
Yes, she has her hands raised up
for a long time.
Yes.
Sorry, I forgot to put it down. Good evening, everyone. And I think it's an excellent initiative. And Kasoga will really do a great job because everyone's so enthusiastic about it. And you have such stalwarts leading your organization.
Yes.
So
that's
there
the main
you have
thing.
So there you have a great plus point. I just wanted to add about what Dr. Hiramat said, and I agree that hypertension is slowly becoming a major killer. However, Vistrit project is focused on two providers, one clinicians as well as for the healthcare workers. So we have to give them the same model. The same model has to go for clinicians as well as for healthcare workers. If the focus on hypertension could be on prediction, could be on diagnosis, could be on management. So I just wondered that if we could scale it down to the level of the healthcare workers, and we need a very, very, very precise thing about what we would like to tell them and counsel them about. Because it cannot be too vast. That's what we did in anemia and GDM. We brought it down to the level which could be focused on the healthcare workers. So that is something we need to focus on. If you go too much into management, I mean, if you take it to magnesium sulfate, it's fine. If you go to justosis score, it's fine. But you can't go too much into the management protocol with the healthcare workers.
Testing.
But I think, you have the guidelines like Dr. Hiramat, you will remember that Dr. Veller did the study with that instrument of BP where they were like road traffic light signals. Yeah.
from
I
UTA.
think Dr. Hema, you know, no, that Columbia University.
I imported 500 sets from there, and it's overcalling, overreading, and now they have kind of, put that instrument to the sideline because it's creating so much anxiety in everybody because it's not, it's no longer validated as a good effect.
Okay.
That was a clip study. In any case, there is a point in what Nivedita is saying, that how to tone it down, and how one small advisory group, Dr. Vidya Topi and her group has to create, so that whatever you're initially with Shobha Shaibi you make, just vet it out with us to kind of, declutter and make it simple. Even if we add 4 points, that these things they should do towards hypertension. That's all. We have a limitation that we already will express in the, add-on project. That to start with, we are doing only this much. We will build over it next time, isn't it?
Yes.
Because, if
Hema,
we would have started 6 months
Hema,
ago, we would
Hema,
have
my-
done it.
Hema, my suggestion is our
Yeah.
simple diamond BP apparatus, which just cost 700, is an excellent equipment.
Yes,
and
I
accurate.
agree.
Excellent and accurate. Only thing
I
is
agree.
we should teach people how to take it.
Yeah.
Even to the health worker, if
Yes.
they take it properly, I think that will definitely help a lot. At least we will be able to detect a hypertension in a pregnant woman.
Yes.
If that much is added, because anyway we are with the patient, we are looking for anemia, we are doing a test for the GCT. I think one BP apparatus.
So, Hiremat, this
Adding-
fits in well with Ekikaran. You should tell Preeti, please tell Dr. Pai, this is Ekikaran. We are integrating one more addition. So, because we have always been discussing with Dr. Pai that if one girl or woman comes, it's not in one vertical that you have to address her, just holistically tell her a bunch of things. So in that, we are adding just one prong. I think we should be able to manage it. That is a new thought of this meeting. We will meet again very soon with the internal
Core
group,
committee.
dash it out and see what best can be done, how in a capsulated manner, in a feasible, practical manner, we can just pull it into an extra module. Yeah.
Extended Vistrit.
Yeah.
Yes, sir. We'll do it.
Nice. Very, very nice.
Shobha, you have to unmute yourself.
Shobha, you have to thank her, Shobha, otherwise we won't go.
Who is giving vote of thanks?
Bharti madam, would you like to talk something?
Vidya, why
Yes.
your EC members are missing? None of the EC members are there.
Sir, they have their own program. So Suman Gaddi had her Bellary program in the evening.
EC members.
So
Who
Yes,
in
yes.
their respective societies, they have got Safe Motherhood committees program. Means they are celebrating Safe Motherhood committee. Means celebration of Safe Motherhood today.
Hello,
They have
sir.
sent few
I
of
am
the
there.
photographs. Shanta is
Yes.
there.
I am there, sir.
Shanta is there, Suman is there, now
Thank you.
slowly.
Suman
Because
is
I was
there.
feeling EC members are missing.
They have not made
Because
their
you are-
videos on.
And you are the 4 pillars of Kasoga. 4 EC members, 4 pillars.
Yes, sir.
We will take them to in task. Who has not come? One more program and project on them.
Yeah.
They have to do.
Okay. Shobha, you can
Nice.
say.
The Sonia Mandappa is there. Would you like to
Yes,
talk
ma'am.
something, madam?
Where is
Sonia is
Sonia?
there. I asked her to.
She is
Yeah.
there, madam.
Sonia,
She is there.
are you there?
Yeah, we all want to see you.
Yes, she is there.
Madam, I'm
Yeah, we
traveling.
want to see you, Sonia.
Yes,
Madam,
I will
Acha, but
see.
you can talk, no?
Good.
You can talk. You can talk your views.
Madam,
this
Tuesday,
program.
I was just
You off your
traveling. That's
video.
why there's network issues, I think.
No, you
They
are
should
your
go to
video.
Kodagu.
We can.
Kodagu. Yes. You can speak, Sonia.
Speak off the video. Oh, madam is there. Yes,
Suman
madam.
Gaddi, madam.
Yes, yes, wonderful program, good initiative, and congratulations, Madam Vidya. Good start.
They also did in Bellary a beautiful
Yeah, yeah.
program today.
We already finished our program on Safe
Yes.
Motherhood today
Yeah.
morning.
So good start today.
Thank
Okay,
you.
sure.
Thank
Shobha,
Thank you.
vote of thanks.
Sir.